Hello, welcome to this video. Where does the government get its funds from? Is it from the private sector or is it from natural resources? So that's a very important question in revenue mobilization, because each revenue mobilization strategy, such as taxes or natural resources or public-private partnership or donor funding, each and every source of revenue has to be critiqued in terms of whether it is equitable, whether it is efficient, whether it is feasible, and whether it will displace other sectors of the economy in terms of financing. So it's very important we get to ask ourselves those key questions. The next key question we should ask ourselves about health financing is a question of prioritization. Where does financing for healthcare rank in terms of government expenditure? And we ask this question seeking to know what percentage of government expenditure goes to health. And that question will answer the question of whether the government has prioritized healthcare spending or financing in relation to other sectors of the economy. The third question we really need to ask ourselves when we are having a conversation about health financing and revenue mobilization: what percentage of the GDP has been allocated to healthcare? The Abuja Declaration said that for government to realize universal healthcare coverage, it needed to commit a minimum of 15% of its GDP to healthcare. That is the amount of financial commitment that was globally recognized as crucial and critical to achievement of universal healthcare coverage. The fourth question that we should always ask ourselves is a question about the proportion of government spending on total health expenditure. Percentage of government funding on total health expenditure. So of all the resources that we spend on healthcare, which percentage is contributed by the government? Is it 20, is it 50, or is it 80%? The higher the percentage, the better. This is because if the government is spending more than everyone else in terms of your healthcare, this provides some form of financial protection on you as a person. You will not have a lot of burden in terms of paying healthcare from your own pocket. So that will be a good thing. So if you are asking a question or trying to assess a revenue mobilization strategy or health financing strategy, it's very important you ask the question of all resources that we spend for healthcare, what percentage is contributed to by the government? Alongside that issue, you'll need to ask another question. Out of all the expenditure, how much is contributed out of pocket? Because out of pocket expenditure for healthcare has pushed people into poverty. Lastly, when engaged in a conversation around revenue mobilization for healthcare, it's very important to ask yourself the fifth important question: how much allocation has the government made to each and every individual living in their country for healthcare? And that is what we normally call the GDP per capita for health. How much has the government allocated for healthcare for each and every person? That's a very important component to think about, because in high developed countries, the GDP per capita for health is actually 10 times over, 10 to 100 times over from low income countries are spending or are allocating for each and every person. So that's a very important component to look at. So the higher, again, the better. Today we have had a discussion about the three health financing functions: revenue mobilization, pooling of those resources, purchasing of healthcare, a conversation of key things to look at when you're talking about revenue mobilization for healthcare. Thank you very much. Let's keep this conversation going, and let's continue unpacking public health policy.